In this video, I'll explain why aesthetic treatments really result in such ugly effects, and the reason will be completely different than you think. If you've had an aesthetic medicine procedure and it didn't work, that's not the worst thing. There's something much worse. You can have a procedure done and end up with ugly results. Don't believe it? Then just look around as you walk down the street and see how many people around you are carrying those unattractive results of aesthetic medicine. The reason why so many women look bad after aesthetic medicine isn't just one, there are several, and the first one will surprise you the most. Reason number one: the practitioner performed the procedure poorly and the patient doesn't realize it. For example, someone got Botox. Basically, the effect of reduced facial movement is strong enough and the patient is generally satisfied. So what's wrong with this scenario? The problem is that it might happen that the results shouldn't actually be satisfactory, but the patient can't tell. To explain this to you, imagine that something starts knocking in your car and you go to the workshop. The mechanic keeps your car for 2 days and then tells you that he replaced, let's say, the ball joint. Now that part is new and it doesn't knock anymore. You pay 5,000 zlotys for the repair. You get into the car, start it up, and indeed there's no knocking. But are you sure the ball joint was actually replaced? And that it actually needed to be replaced? Or maybe there's no such thing as a ball joint at all and the mechanic just tightened some screw, for example? I'm not saying that mechanics or doctors always want to cheat you, though such cases probably do happen. But it's important for you to know that patients aren't always able to judge on their own whether the result is as it should be. Examples? Here you go. Most often, it's unnatural facial expressions after Botox, not completely frozen, but still far from something that suits the patient. Another very common example is slight migration of filler around the lips or lumps forming, not yet visible in every situation, but noticeable to the person. Besides what I've already mentioned, there's another situation where aesthetic medicine will definitely produce ugly results, and it happens all the time. The second situation: a poorly chosen procedure for the problem. If you've ever visited the website or Instagram of an aesthetic medicine clinic, you might get the impression that every procedure is suitable for every problem. It's something like, do you have drooping corners of your mouth? Okay, that's perfect, because in our clinic we have 74 wonderful procedures that are ideal and the best for this problem. Unfortunately, that's not how it works, and choosing the wrong procedure for an aesthetic problem is one of the biggest oversights and reasons why procedures produce unattractive results. Here are some specific examples. Hyaluronic acid chosen to firm the skin even though hyaluronic acid does not produce that effect. Botox chosen to lift drooping eyelids, which is practically impossible. Lip augmentation with filler to give the lips a more red color. Laser treatment for eyelid lifting, which does not actually provide such a lift. Botox for the corners of the mouth when the problem is not in the muscles but in the tissues. Lip augmentation to even out their contour. Lifting threads for a patient with thin skin. I could go on like this for a long time, but I fully stand by what I said in the introduction. So if you had an aesthetic procedure and there's no effect, that's not the worst thing. It's much worse when you undergo the wrong procedure and the result turns out unattractive. Of course, it's not you who has to decide on the procedure, but I'll talk more about responsibility later, so make sure to watch this video until the end. Before I move on to the third point, I have some important information. If you're not yet at the point where you're using aesthetic medicine treatments and what I'm talking about makes you a bit uneasy, I have a solution for you. Right now, you can join my challenge 5 days to better skin completely free of charge. In it, I show you how to take smart care of your appearance without any aesthetic procedures, using only home and free methods. That's why you have nothing to lose, but a lot to gain. Check the link in the description and join my free challenge. And now we move on to the next reason why aesthetic medicine can produce unattractive results. A reason that is the hardest to talk about. Reason number 3. The doctor has a different sense of aesthetics than the patient. In other words, what looks natural to a doctor might be something completely different than what looks natural to you. Imagine this scenario. You meet a complete stranger, hand her your credit card and say, "Go shopping at the mall and buy me a nice dress. One that will suit me and make me feel like myself." 2 hours go by and this person comes back to you with a shopping bag. And now the question is, what are the chances that this stranger will perfectly match your taste? And what if the dress is generally nice but just isn't right for you specifically? The same thing can unfortunately happen with aesthetic medicine treatments when you're looking for a natural look. For the doctor or practitioner, this might mean something completely different than it does for you. My advice? This can be precisely determined between the practitioner and the patient what exactly we're aiming for, so that there are no accidents or surprises. But it requires time to ask questions and for the practitioner to truly understand, not a conveyor belt approach. That's why you should look for specialists for whom consultation and understanding your needs are very important. I have one more piece of advice. Before you entrust your face to someone, check their style. What do they look like? What do they talk about? And how do they communicate on social media? What kind of results do they consider beautiful? Before you go for a procedure, schedule a consultation. Listen to how the doctor speaks, what they suggest, and what their approach is. If it aligns with yours, then you're closer to being on the same page. However, be careful. Besides the doctor's sense of aesthetics, there's another mistake that women often make when considering aesthetic medicine. Reason number 4. You focus only on one type of aging, while aging is not just about wrinkles. Many of us think that aging means that when you're 20, you don't have wrinkles, and when you're 70, you have wrinkles and look old. So you could compare it to an arrow going from the present moment to some point in the future when there are already a lot of wrinkles and you look old. Nothing could be further from the truth. Facial aging can be illustrated not as a single arrow, but as several arrows pointing in the same direction, but at different speeds. So aging is not just about wrinkles. Those other arrows include things like the appearance of discolorations, which we get more of as we age, looser and more sagging skin, loss of fat tissue, subcutaneous tissue, and the atrophy of the skull bones, all of which change our facial features. Changes in the function of facial muscles, where some work too hard and create wrinkles, while others are too weak and, for example, don't drain lymph properly, leading to swelling, as well as decreased skin hydration and loss of the hydrolipid barrier. Why am I listing all these things? Because aesthetic medicine will end up looking quite terrible on your face if you keep repeatedly fixing just one of these particular things over and over again, but do absolutely nothing about the other important issues. For example, if you keep getting only Botox for years, you'll end up with a super smooth and youthful forehead, but if the rest of your face is neglected, you'll look strange and unnatural. That's why smart aesthetic medicine shouldn't be about repeating the same procedure over and over, but rather about addressing each of the things I've mentioned and taking care of your appearance in a holistic way. And as proof that we often disrupt this naturalness by our own choice, I have another reason why aesthetic procedures can produce unattractive results. This one is the most common. Reason number 5. Lip augmentation without understanding facial proportions. In a nutshell, as a patient, your goal is not to get a lip procedure just so the practitioner can have nice before and after photos to post on Instagram. Because if you've noticed, most often in such photos, it's just the lips shown, due to identity protection. However, I'm certain that very often those perfect lips in before and after results, if they were shown in the context of the whole face, would look much less spectacular. That's because lips shouldn't be shaped just to make the lips look nice, but to make the entire face look more natural with the new lips. If this distinction doesn't sound very clear to you, let me ask you a question. When you last saw a stranger on the street with enhanced lips, why did they look enhanced to you? Paradoxically, very often it wasn't because the lips were objectively too big or had an objectively bad shape. Take a closer look next time, but I'm almost certain that in most cases you notice it won't be about the lips being generally too big or having a strange shape, but rather about the size or shape not fitting that particular person. Do you feel that difference? It's just like in a store, an XS or XL size isn't bad in itself, but if someone wears a size that doesn't fit them, that's when it starts to look odd. Are you staring at my belly? I just glanced. That's why enlarging lips without understanding and respecting the proportions of the face is one of the main reasons why aesthetic procedures can lead to unattractive results. Remember, you're not doing this procedure just for a nice before and after on Instagram, but to feel great in your own skin and above all, without losing your natural look. Speaking of losing naturalness and exaggerated results, I have to mention one more reason why we consider aesthetic medicine as something that can worsen your appearance. Reason number 6. Too much product was used, too much hyaluronic acid, too much Botox, too many stimulators, threads, lasers, everything. But I won't leave you with just that statement. Because what does too much actually mean? Is half a liter of filler too much, and is half a milliliter too little or too much? The rule you should follow is simple, though not easy. It goes, you should aim for the best possible results using the smallest possible amount of product. Because it's not an achievement to inject, for example, 10 milliliters of hyaluronic acid into the face. The real skill is to use 1 or 2 milliliters and achieve a better result than someone else who uses several times more product. However, unfortunately, we often encounter situations where the product was injected where it wasn't needed, or simply too much of it was used. This is especially true for products that remain in the skin for a longer time, such as hyaluronic acid. But that's the case with every procedure. What advice do I have for this? Makeovers and transformations in 15 minutes look great on social media, but they are often far from what could be called smart aesthetic medicine. Only such a balanced and cautious approach to procedures, both from the doctor and the patient, ensures that we have no chance of getting unattractive results. But using too much product is not the only issue. There may also be one more, final thing that can quickly lead to poor results. Reason number 7 why aesthetic medicine can produce unattractive results. Procedures performed too frequently. Generally speaking, in-office procedures are great because they really do deliver visible results, and when you go for your first treatments, you look better. This makes you want to use such procedures more and more often, especially since as a patient you might feel like there's another amazing treatment just around the corner, or you received a voucher, or you have the impression that the effect has faded a bit since the last time. There are many reasons to go for another treatment. However, I strongly warn against taking matters into your own hands in this area and making snap decisions like, I'll just get some volumetry done. Decisions about further treatments should not be made on impulse, spontaneously, or on your own. Quite the opposite. Treatments should be carried out in stages and according to a plan agreed upon with your doctor. Otherwise, you risk unnecessary complications and unsightly results. I'm especially referring here to procedures involving hyaluronic acid. It turns out that such hyaluronic acid remains in the body much longer than was believed until recently. How long? There are studies showing that the acid did not disappear from the face even after more than a dozen years following the procedure. The topic of hyaluronic acid is so important that I recorded a separate video about it, in which I describe the situation and these studies in detail. So if you've ever thought about aesthetic medicine, be sure to click on the video thumbnail that's appearing now and find out what the long-term consequences are of procedures with hyaluronic acid, such as volumetry or lip augmentation. I also have a big favor to ask. If you found this video interesting, please leave me a comment below for the reach. Thanks to that, YouTube will show it to more people. Thank you for that and for watching my videos. See you in the next one. Kisses!